Good morning. Thank you for all those who walked across campus to come to this auditorium. Of course, our children's colleagues have to do this almost every week, so it's fair that we do this every once in a while. We have two great talks this morning. The first is by Dr. Megan Adams, who's an associate professor in the transplant division. She's surgical director of pediatric liver transplant and transplant in general. By way of her training background, my guess is you come from Michigan, undergraduate at University of Michigan, medical school at Wayne State, and then she moved to beautiful Colorado to do her general surgery training as well as her transplant training. So she is, first of all, a technically excellent surgeon and really runs one of the top pediatric transplant programs in the country. And I know she's technically excellent from several sources. I operated with her a lot during her training in general surgery. And, I don't participate in the liver transplants, but I hear from other surgeons how good she is. She's very well published on some very important papers. In fact, we're co-authors on some of them. And the fellows and residents really love working with her and they seek her out. And I think this is probably from what she will be talking about today, her leadership characteristics through thick and thin. Her topic, leading through crisis and loss, is obviously a really timely one. We've had two major losses in the Department of Surgery with Michael Wax and then David Fullerton, not so long ago. And there's a lot going on in this world. There's a lot going on in this university, department, government, everything. And right now, we need leaders more than anything. And we look forward to your insights on this. Dr. Adams, thank you.
Thank you to Dr. Schulich and Dr. McIntyre for inviting me to come. And also a special thank you to Dr. Carr and Dr. Com, who came back for my talk. When I was initially asked to give grand rounds back in the fall, I was going to talk about all of the cool things that we were doing in pediatric transplant. But then when Michael passed away, it felt a little disingenuous. And how I came to be interested in this topic is last summer, I was looking at a leadership job elsewhere. And I thought, I've had some really good leaders and some not so great leaders. And what could I do to make myself a better leader? And so I started reading books. And when I changed my topic from pediatric transplant to this, I, went more into the science, which you'll see there's actually not that much of. But as Dr. Schulich mentioned, it's a time of total crisis and chaos in the world. And I think if we could define a few leadership characteristics that make you effective and make your team more effective, it makes the whole system run better. An alternate title for this talk would have been What a Long Strange Trip It's Been, as an homage to Jerry, who was Michael's idol. I have no financial disclosures. On a personal note, this is a relatively new topic to me that I've become interested in the last year. So objectives, to understand both the emotional and functional impact of crisis and loss in surgical teams, to explore evidence-based physician leadership strategies, apply frameworks for team resilience and healing, and reflect on our shared experience. As Dr. Schulich mentioned, in 2024, we lost both Dr. Fullerton and our division went through a leadership change. And on January 17th, Michael Wax suddenly and unexpectedly passed away. I would say on a personal note, Dr. Wax and Dr. Neidham have always been the emotional backbone of the group. These are two people that have had a very high emotional intelligence, in my opinion, and they were the ones to support our group the most through the leadership change in the last year. And I wanted to drill down on some other qualities that have made them amazing leaders and mentors. My origin story is that I came here as a medical student in 2009. I was visiting from Detroit, and I rotated on the transplant surgery service. And that's when I first met Dr. Wax. And I could immediately tell that he was not only an outstanding surgeon, but a very kind person. On the day that I matched, I got a call from Dr. Neidham, who was finishing his chief year here and about to start his transplant surgery fellowship. And he had gone to Wayne State also, and he was just calling to welcome me to Colorado. And I could tell that I was joining an amazing group of people. This is a picture of Michael holding my firstborn. He, having no grandchildren of his own, quickly became a grandfather figure to my own. When Henry was about 3 months old, he came over with the game Operation. And I said, Michael, he's 3 months old. He cannot play this game. And he said, I know, but I want to be sure that I'm the one that gives it to him. When Michael was in the hospital, I went out to lunch with my best friend, who many people know in this room. She was a general surgery resident here. She's now a vascular surgeon at Denver Health. But she said, I've been thinking about why this has been so difficult for me. Wax was one of the few that treated us like humans in a time where that was rare to do. And I think that really drills down to what I'm going to get at in the talk, is that having a high emotional intelligence and having social awareness and treating people like competent people and supporting them is the best way to build a team and a collaborative, safe environment. To take a moment and talk about the history of leadership and mentorship at this program, this is Michael Wax and Tom Starzl back in Dr. Wax's early days. This photo actually was taped to our like bookshelf thing in our office that we shared. And one day he like pulled it down, this was years ago, and said, when I die, I want you to have this picture of us. And you can even see, I don't know how to do the pointer here. There's the tape outline still where I scanned the picture. But Tom Starzl was widely regarded as the father of liver transplantation. Starzl was a surgeon and a researcher in the then nascent field of organ transplantation. And he was at the University of Colorado from 1962 until he moved to Pittsburgh in 1981. And he performed the first ever liver transplant in the world at Children's Hospital in 1967. Not this Children's Hospital, but the old one. In 1984, from 1986, Dr. Kamm was trained by Tom Starzl in Pittsburgh. He then returned to Israel for several years before he was recruited back to the University of Colorado to help restart the transplant program along with Dr. Carr. Dr. Kamm then recruited Michael out of fellowship from UCSF, and together, these three men helped to train the future of transplant surgery. So getting back a little bit to the topic in general, crisis, whether it be from leadership change, institutional change, government change, can lead to stress, disorientation, burnout, grief, and fragmentation. Physicians are trained to lead, and I'm going to argue maybe we are trained to lead, but not necessarily how to grieve. Everybody knows the Kubler-Ross grief cycle begins with denial, then anger, bargaining, depression, and acceptance. But what I didn't know is that there's actual leadership strategies for each of these different stages of grief. In the early stages, information and communication is crucial. There's not much to do other than to communicate information, and I'm going to talk a little bit how our team did that during this time period. Then emotional support, which is exactly what we did. And I don't know that we actually knew we were doing these things, or Dr. Neidham knew that he was doing these things in this order, but this is kind of what happened. And then guidance and direction. When I got into the actual literature about leadership and grief and loss, I came across this article by, she was the ex-director of an OPO in New England. And she talks about how grief and loss is so different in the transplant profession because it's something we're so trained to deal with. And she mentions that there's not many professions where the days begin and end with death. And often that the death of one individual is the only thing that will prevent the death of another. And this applies to all professions. You spend 50% of your awake time in the place of your employment. And so oftentimes your employment groups really become like a second family. She also mentions that fundamental to the understanding of mourning is that each loss launches an inescapable course through grief. Each loss revives all past losses, and each loss, if fully mourned, can be a vehicle for growth and regeneration. Two things that are mentioned in the literature in the early phase of recognizing and holding space for grief are rituals, memorials, and team reflection. and also the healing role of vulnerability in its leaders. And this is an email that Dr. Neidham sent out on the day after Michael was admitted to the hospital. And it basically says, we're going to have a Zoom. We're going to be supported by the Department of Surgery, the psychiatry division that supports the Department of Surgery. And it really was just a place for all of us to sit on a call. And sometimes it was quiet and uncomfortable. And sometimes people opened up and shared their thoughts about Michael. And it was nice to just sit in a space where we could all talk openly about what was happening. I wanted to specifically point out there are 2 really good websites that are useful, both for faculty, medical staff, and providers, and then also GME. And I have to specifically call out Zach Asher, who's here today, and Dr. Leto from the psychiatry department, who really were the ones that helped to support us through this whole thing. What is emotional intelligence? Goleman, who was the one that initially introduced the idea of emotional intelligence, said it's made up of 5 components: self-awareness, self-regulation, motivation, empathy, and social skill. Self-awareness is the conscious knowledge of one's character, feelings, motive, and desire. Self-regulation is the ability to control or redirect disruptive impulses or moods, and the propensity to suspend judgment. Motivation is a passion for work for reasons that go beyond money or status, and the propensity to pursue goals with energy and persistence. Empathy is the ability to understand the emotional makeup of other people, and skill in treating people according to their own emotional reactions. And social skill is proficiency in managing relationships and building networks. But I found a clip from this paper that I actually liked better about social skill. They define it as friendliness with a purpose, moving people in the direction that you desire. And I also liked this little clip. Self-aware job candidates will be frank in admitting to failure and will often tell their tales with a smile. And I think that goes along a lot with humility. What is psychological safety? Psychological safety is the belief that you won't be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. At work, it's a shared expectation held by members of a team that teammates will not embarrass, reject, or punish them for sharing ideas, taking risks, or soliciting feedback. And we really want, we want everybody to be operating up here. We all have high performance and high standards of accountability. But in order to get here, we also have to work in a place of high psychological safety. And that is one thing that I think that sometimes gets missed in surgical culture. In my reading over the last year, I really, and I'll come back to this, have gotten into the book Leaders Eat Last by Simon Sinek. And something that he describes is the circle of safety. And he likens it to in Africa, when the wildebeest are out in the plains, that they will, in order to protect themselves, they'll form a group and they'll put their butts together and their heads out so that they can protect themselves as a group from outside danger. But the second that the wildebeest start infighting and move out of this circle of safety and out to their own territories is when they can get picked off by lions. And he also tells a story about Spartan warriors who are arguably some of the best warriors in the history. And that if a warrior lost his helmet or his breastplate in battle, that was a non-issue. But if a warrior lost his shield, that was punishable by loss of citizenship rights, because the shield is meant to protect the entire group, and the helmet and breastplate are meant to protect his own body. So then I decided, these are my global concepts that I had learned through my book reading. I decided to turn to literature. I initially typed in leadership styles in medicine, which resulted in about 262 results. But I found that most of them were directed at nursing leadership. There was very few physician leadership papers. So then I typed in surgeon leadership styles, which only returned 52 results. And most of them were really focused on definable transactional interactions, like in the operating room, how do you get your mentee to do this? Or how do you, they're small definable actions, but there was very little about how to lead globally. I'm going to go through this part pretty quickly because I think there's more important things to get to later in the presentation, but these are the Goleman's leadership styles. And we're going to get into this, how this applies to different hierarchical levels of medical education. And on the bottom here, they range from the cumulative effect on morale. I'm going to go through each of them very quickly. Coercive or commanding leadership is a situation in which leaderships demand immediate compliance. This is good in crisis situations where quick decisions are needed, but it can stifle creativity and morale if it's overused. And a good example of this is Steve Jobs. Pace-setting leadership sets high performance standards and leads by example. This works well with highly skilled, self-motivated teams. And I think a lot of times this is a good leadership technique in surgical culture, but it can lead to burnout if expectations are unrealistic. And this was how Jeff Bezos, who is the founder and executive chairman of Amazon, built his company. Democratic leadership encourages collaboration and values team input. It strengthens team morale and fosters a sense of ownership. It's best used when collective decision-making is beneficial. Affiliative leadership, which is, I think, what I'm going to argue is one of the best leadership styles, especially in times of crisis, focuses on emotional bonds and team harmony, prioritizes employee well-being, building loyalty and trust, and it's effective in times of stress or team rebuilding. Coaching focuses on developing employees for the long term. It encourages learning, feedback, and personal growth. And it's effective when employees need mentoring or skill building when they're moving into a new area of their field. And visionary leadership, while Elon Musk may not be a very popular figure right now, has done some pretty remarkable things in the business world. Leaders provide a clear vision and direction, inspiring teams to follow. It encourages innovation and long-term thinking, and it's best used when an organization needs new direction. Of all of the people I just put up here, they're all excellent leaders. None of them are bad leaders, except for maybe Elon Musk right now. But what applies best to medical and surgical education? This was a study in which they came out in 2017. They interviewed 42 leaders of different levels of leadership. There was first level leaders that were chief residents, undergraduate student leaders, middle level, which were at the level of program coordinators, curriculum chairs, and directors of academic centers, and senior level were associate and assistant deans and deans. There was a higher male to female ratio at every single group. And obviously, as you progressed in the leadership realm, your age increased as well. What it found was that as a group, first level leaders preferred a democratic leadership style. And they postulated why first level leaders would like a democratic leadership style is that you don't really have that much that you're controlling, and you're mostly working with a group of your peers. And so that may seem like the best option when you're working with a peer group or one does not clearly have a power differential over the other. The middle level leaders strongly preferred a coaching leadership style. And these are people that are moving into new roles of leadership and experiencing new domains of their job. And so they might need a little bit more help. And what they found with the senior level leaders is that they frequently use visionary and affiliative leadership methods, but incorporated more different methods than the lower leaders do. And I think that speaks to not every leadership style is effective all of the time. And different scenarios require different types of leadership in different times. And just to bring this back in terms of where you fall on the morale scale, the first level leaders, were firmly in the center of what the leadership style does for team morale. The middle level leaders were more on the left side, and the senior leaders preferred two different methods, but none of them really chose pace setting or coercive leadership styles. Another leadership idea is conscious leadership. This isn't necessarily a leadership style, but it's an idea about how to think and lead at the same time. And it's about being more interested in learning than being right. When our egos make us afraid to be wrong, that fear leads us to defend our ideas at all costs and to work hard to convince others that we were right, often with anger. Whoops. Matt Mokery, who's the author of the book, The Great CEO Within, talks about leading above the line and below the line. And when you're above the line, you're open, you're curious, and you're committed to learning. And when you're below the line, you're closed, defensive, and committed to being right. And I think one thing that we can all agree upon is that we should all strive to be leading from above the line. In my reading, I came across this book, this quote from this book. And the quote is, "The first responsibility of a leader is to define reality. The last is to say thank you. In between, the leader is a servant." And I think when you are appreciative of your team's work and you are helping to support them, your team goes farther. And this goes back to building trust, mitigating isolation, the circle of safety. In the book that I was referencing before, Leaders Eat Last, they studied this leadership tactic in all different forms. They studied it in big company takeovers, or in very small situations on like an assembly line where when one leader came in to take over a new company, the whole company was functioning well except for the assembly line. And the assembly line people had to clock in, clock out. They had to get a special key in order just to access the cabinet to get a new part. And so this new leader came in and said, you know what, you're all adults. You can decide when you take a break. You don't need a key from me. I'm going to support you in your job. And overnight, productivity increased, the employee satisfaction rate increased. And you know, he doesn't specifically say it in the book, but I really think he's talking about this idea of affiliative, or another word for it is servant leadership. The servant leadership, which is kind of a different subset of leadership styles. Leaders put the needs of their team first, sacrificing their own comfort and for advancement of the good of the group. So what can leaders do during times of crisis or times of immense loss? They can communicate transparently. They can check in on individuals. They can model self-care and vulnerability. And they can invite shared decision-making. And this is another email from Dr. Knighton about another session we had. And I just want you to notice how he signed the email. I don't think he did this with any intention, but he said, "Take care of yourselves and your family this weekend. Thinking of you all, Trevor." This is a poem, just to kind of close out, that is hanging in Michael and I's office, and it's called "If" by Rudyard Kipling. I was going to put the whole poem up, but it would be a lot to read, so I just decided to have Michael Caine read it for you instead. Maybe. That's unfortunate. That's what I'm just gonna try to do it here. Well, it's a great poem. It talks about if you do this, then you will become a great leader. If you do this, you will be happy with yourself at the end of the day. And it's all about really about social intelligence, about creating a place of psychological safety and supporting others. Some key takeaways from the talk. Leaders support not just direction, but also healing. Emotional intelligence and creating psychological safety are critical skills. Surgical teams need space and support to process grief, and empowered teams recover stronger. I'm not going to read all of these things, but these were some, everybody on this screen is a past resident trainee of this program, and they're all out in different programs. None of them are here. But things that people had said about Dr. Wax when he passed away. And I think the theme is that he was an amazing mentor. He was an amazing educator. And he really thought about everybody as an individual and how to best support their career goals and their surgical goals. And with that, I would like to thank everybody for allowing me to speak, take questions, open discussion. And these are 4 of the books that I mentioned in this talk, if anybody has any interest in delving into leadership realm.
Any questions or comments to this excellent talk, Dr. Malcor?
My fellow person here that she would like to ask a question. So I'm going to ask the question. So she asked this question. She would like to ask this question. What's your advice for people to obtain more insight and self-awareness of their own emotional intelligence and how to grow it?
Yeah, so there are a lot of all of these things I talk about. There's verified questionnaires and kind of activities where you can take a questionnaire and it will analyze it for you and tell you where you're at on your own self-awareness, on your own emotional intelligence. I actually did it myself, and while I thought I was a pretty emotionally intelligent person, I have some room to grow, as I think everybody does. But they're out there. They're all verified questionnaires.
What about
Hey, this is Peter. Megan, that you highlighted so many things that we as a group went through in January and still. And I know how, Michael touched a lot of people, but I know specifically how much he meant to you as a person and a surgeon. And I think what you've been able to do here and highlight all of these things was probably very difficult to do, and you did it really well. And I also want to say, our group has always been tight, but it's gotten tighter in the last almost year now. And I just want to congratulate you on what you've done and all of your successes, and thank you for highlighting all these things.